right across that corner, yeah. I mean, the best shot I had there was some network, I forget which one, where they had rooms in that hotel. So they said to the hotel, okay, we're gonna set up our thing, you know, like on the corner of the building. Yeah. I think we looked out the window for some of it, and we just went outside on their sidewalk.
Someone else was over at the on Rose Wharf at the.
Oh, during the tsunami track.
Yeah.
NBC was there. They had a balcony.
Nice shot.
Yeah, they spent like $600 a night.
No, I think
Not even I guess one of the producers was probably sleeping on the roof. That was nuts. Yeah. But even then, they weren't that pleased with it because it would take to get from the Rose Wharf to get over. Yeah. Well, they probably got a deal for it. Yeah, I know, but they yeah, literally right across from the courthouse.
our station had a Christmas party here at
Yeah. Strega, that's a nice place.
So we got a room there the first year. It was like $200.
Oh, yeah.
They had a party another year at the Grand, which is right over here across the street from the courthouse.
Excuse me?
One of those.
I think I had a little notebook there.
Yeah.
I'm not 6 weeks partners. What the hell is that?
Jesus.
Wow.
Wow.
So then we found an Airbnb, a nice condo in Southie that was a $8 Uber right away, and saved about $300.
Yeah, I think it's smart. Sometimes it just depends on the day of the week, what's in town, what's going on.
How many days a week do you get out of school, would you say?
This week it was 3. That's how they were.
Ask tough questions.
I'm good. How are you?
Sometimes you're on with Patrick.
I wanted like maybe 2. I wanted a week. Yes.
Larry,
Hey, for Price.
Your pool? Oh, nice. Okay, I'll see you afterwards. Probably have to buy you lunch or something. For that one shot.
Alright, I can be bought.
What's over there?
So we're sharing this repairs, I open, it's going on Twitter.
Should I be sitting one away? Is that what's the protocol?
That works for me. Okay.
You live streaming? Yeah. Audio?
It's
Yeah, whatever.
I don't think they're coming down.
You want to just give us a 2-minute warning?
We will,
Okay,
yes.
great, thank you.
Oh my god, it was hilarious. And I made a video. I over taped it on. That's just
No, no, we just have
Here's my
I guess we have.
New information, facts are changing. That's the name of the game.
That is the new norm.
How long, Terry?
You are alive.
A few more minutes.
Is everyone still good on sound, or do you want to do another mic check? Everyone's good? Dritz?
They think I'm shooting it.
Kucher.
Yeah, the kid's just fine.
Oh, yeah. Or variation of the testing. Yeah. Sounds like the big thing.
Yeah, well,
Everybody else, you know.
I mean, they could put in some stuff. Sort of all.
Well, I thought that's you moving on to which would be the.
But they have, they have.
Limited.
Yeah, so.
Good afternoon, everyone. Welcome to. Just want to make sure, Bobby.
Yeah, sounds good.
Right. more minutes. A few more minutes.
You said that a few more minutes ago.
I know. Oh, I know. Totally forgot about that.
Oh, yeah.
Tonight one was about 5 minutes ago. The second two.
That was the few minutes.
The season has been called off, so there's no games, so there'll be no two in the morning, so it's all fungible. Right?
Oh, yeah.
Thank you for that.
You don't have a season, you don't really have two in one, or at least it doesn't have to be two.
You days?
What if they had passports money?
I'm assuming some people were. Is that what you actually
No, no, you're on, sir. Keep going. Huh?
So, it was Alex, and it's actually a good one. So we should have done something about it. I have six photographers who take different people rather than just one by one. It makes sense.
Anytime, Terry? Anytime? Huh? Soon? Okay.
Few minutes.
It's a few minutes more, Chairman. Good to see you.
Send out like I'm not seeing they're probably back today.
Made that.
Yeah. That's pretty.
You were having some,
Yeah.
You told me to touch his face today? Right. Probably about 25 times the last time.
I did see that.
It's hard though, you know? It's simple. I don't touch your face, I don't know what you think of that.
Like, oh, no.
You're all. Where's the carrier?
how's it?
See what would happen? You know what happened? Nobody would. I'm like,
now this fighting's over.
Oh, yeah. I'm like, this is not my fault. I can't move. Right, you know, and so you have no choice. That's true. But
Two minutes, guys. 2 minutes. 2 minutes, yeah. We'll turn the lights on, don't worry.
Come in. Come right into the Oval Office. That's right after.
Yeah, we're gonna turn them on when the door opens.
New energy saving policy. So we can adjust our iris as you walk.
Good afternoon. Thanks again for joining us for an update on COVID-19. As most of you know, the number of reported cases has seen a significant uptick in the United States and in Massachusetts, and our state health officials are closely monitoring and tracing presumptive positive cases, which currently stand at 108 presumptive positive cases here in the Commonwealth. This outbreak and the impact of concerns over the spread is already being felt by everyone. We've seen professional sport cancellations, travel restrictions, and a host of postponements and cancellations for big events and activities. It's hard to believe, and it's certainly disappointing and upsetting, I think, for everybody. And this does represent a significant change in daily life for the vast majority of people here in the Commonwealth. So I've said before, the time period we are in now marks a pivotal moment on what we do and how we behave in our daily life to mitigate the spread of COVID-19. Right now, the data indicates that the number of people infected and requiring medical attention is very much within our healthcare system's capacity to serve and handle. The highly contagious nature of this disease means that if everyone plays their part in slowing the spread down, the number of people who become infected and require medical attention doesn't spike all at once, which perhaps would overwhelm our systems. We understand that asking people to change their habits, cancel events, and cancel travel is inconvenient, and we understand that it also comes with a financial impact. But waiting to act and allowing infections and subsequent number of people who need medical attention to spike all at once will not only severely hamper our hospital's ability to care for those who need to be cared for, but will have a far greater economic impact in the future as well. Today, one of the additional steps we're taking to prevent the spread and keep our communities safe is we've just issued guidance that will prohibit gatherings of over 250 people in the Commonwealth effective immediately. The gatherings in this order are subject, but are not limited to, community, civic, public, and leisure gatherings, faith-based events, sporting events with spectators, concerts, conventions, fundraisers, parades, fairs, festivals, and any similar event or activity that brings together 250 or more persons in a single room or single space at the same time. This order does not apply to the normal operations at airports, bus and train stations, medical facilities, libraries, shopping malls and centers, polling locations, grocery or retail stores, or other spaces where 250 more persons may be in transit. The order also does not apply to restaurants, provided that they should, whenever possible, encourage social distancing. Finally, this order does not apply to typical office environments, government buildings, or factories where large numbers of people are present, but it is unusual for them to be within arm's length of one another. I know there will be questions on the particulars of this guidance. We've posted it in its entirety on mass.gov and encourage folks to refer to the details on the order for more information. I'd also like to talk a little bit about separate guidance issued by the Department of Elementary and Secondary Education and the Department of Public Health. Earlier today, DESE spoke with school superintendents from across the Commonwealth, and with our Department of Public Health's guidance and support, issued detailed guidance to our public schools about how districts should respond to mitigate the spread of coronavirus. That guidance gives schools very specific advice about when to close individual schools and for how long. Our public health officials do not recommend school systems shut down system-wide at this time. They recommend careful monitoring of students and temporary closures to allow for schools to clean and reopen. For more detailed information, please see the specific guidance which has been posted on the website. Federal officials continue to issue new rules and guidance related to travel restrictions and social distancing. We encourage the public to remain informed and to follow that guidance. We will continue to enforce recommendations at the state level as well. Earlier this week, we declared a state of emergency here in Massachusetts, and that declaration does give our administration more flexibility to respond to this outbreak. We've enhanced guidance to executive branch employees, and we encourage employers and organizations to follow that guidance whenever appropriate. We've also limited visitor access to long-term care facilities to keep some of our most vulnerable residents safe. And we've encouraged older adults and individuals with health issues to avoid large gatherings and large events. And of course, we should all remember to maintain our personal hygiene, and that means wash your hands 20 seconds, warm water regularly, and use hand sanitizer. Cover your mouth with your sleeve if you sneeze or cough. Stay home if you're not feeling well, and stay informed on guidance coming from health officials. Everybody needs to do their part on this for us to be successful in reducing the spread of this virus at this time. Thank you. With that, I'm going to turn it over to Secretary Sudders.
I was going to say good morning, but good afternoon. As the governor said, Massachusetts continues to receive CDC test kits and uses the kits consistent with the CDC guidelines to identify positive cases of COVID-19 as quickly as possible. We continue to request and receive new test kits and are able to test an additional 5,000 individuals. Our state public health lab is working 24/7 and turning around results in 24 to 48 hours, depending on test volume. And beginning sometime next week, we will actually be able to double the capacity of testing at our state lab from about 200 a day to 400 a day, with additional automation going in place over this weekend. Yesterday, we received good news that 2 commercial labs, LabCorp and Quest Diagnostics, received federal approval for testing, which will support our state lab to expedite the testing process. As the governor has said, it is important that more labs be approved by the federal government and come online in Massachusetts, and we continue to urge the FDA and CDC to help us expand our testing capacity so that we can test more residents across the Commonwealth. Additionally, beginning next week, in fact on Wednesdays at noontime, we will be posting the testing data online in terms of the number of people who have been tested and the number of individuals who are positive. Every Wednesday at 12 p.m., this will coincide with our weekly updates to self-quarantine monitoring data. Late yesterday afternoon, actually early evening, we received our first partial shipment from the Strategic National Stockpile, which is administered by the U.S. Department of Health and Human Services. It's a supplies of gowns, masks, eye protection, and gloves. We quickly deployed some of that material to Berkshire late last evening, and we are continuing to fulfill orders today and throughout the weekend. As the governor mentioned, I just want to reiterate, if you go on to the mass.gov DPH COVID-19, you will see specific guidances for all of our long-term care facilities. I'm talking about nursing homes, rest homes, and assisted living, where we have actually issued visitation restrictions, as well as we have posted very specific guidances for other congregate care settings, such as 24/7 group homes, just as an example, guidances for in-home caregivers and workers, both agency-based and non-agency-based, and community day program settings. And finally, at this moment, I am pleased to announce that our 211 line is officially up and running in English, Spanish, and other languages. And we would encourage the public to call 211, and they will get an automated menu of options, behavioral health, other options, and specifically coronavirus. Callers press 26 for coronavirus. The call taker answers in English. If another language is needed, the operator connects to one of 150 languages and dialects, pulling in a translator. Operators have been given very brief scripts and will provide answers using DPH website as a source of truth. The new 211 capabilities are in addition to the mass.gov/COVID-19, which is updated daily.
Questions?
Earlier this week, we talked about LabCorp and Quest Diagnostics getting approval. And at the time, I think it was Monday, you were hopeful they would have approval on Monday. But it's been a week now. Why did it take so long? It requires federal approval. Their information had gone into the federal approval for to be approved, and it was approved yesterday.
Is there any way you
So you know, the governor has been very clear. We've been very proactive with both our congressional delegation and with others who've been terrific in helping advocate with the federal government for expedited approval of our request.
There was
How many
nobody
tests
eligible
have been
for a
conducted
test
so
right
far?
now.
Do you have undiagnosed cases? Do you have a projection? Some governors are saying 100,000 cases of undiagnosed.
Do you have any sort of number based on how many we have presumptive positive? Is there some sort of working scenario of how many projected cases we may have?
So, well, I don't have a specific number. As we have said, starting next Wednesday, we will post the number of individuals who are tested in Massachusetts. And obviously, every day we put out, you know, the presumptive positives. And yes, we are engaged in sort of scenario planning at this time for what may come in Massachusetts, but we're really just doing the scenario planning now.
Amid the shortage, who is eligible for the test
Why are
right
public
now?
health officials not recommending schools be closed right now? A lot of people are asking about that.
I should probably let the secretary respond to this, but we spent a lot of time with the public health folks talking about this. And the basic conclusion from that conversation was people should be making that decision based on the facts associated with their school. In other words, if you have a parent who has tested positive and they have kids in your school, they make recommendations with respect to that. If you have a child in the school that's tested positive, they have recommendations with respect to that. If you have a parent in more than one school who's been tested positive, they make recommendations with respect to that. But their overarching recommendation from a public health point of view is just shutting schools down completely does not appear to be the appropriate thing to do at this time.
Governor, could I ask you, do you have the power, is that within your purview to shut down schools? Should you decide that that's warranted?
Under the executive order, we have pretty broad authority, but we would need a clear rationale to do such a thing. And at this point in time, the Department of Public Health is recommending what I would describe as a surgical and fact-based approach in a particular district and a particular school to make a decision with respect to how to handle school closings, not to just do a blanket across-the-board decision.
But how many superintendents and town administrators?
Pardon me?
Why is it so important for you to keep schools open and not make a blanket decision?
Because the recommendation I'm getting from the folks at the Department of Public Health is that that would not be in the best interests of the Commonwealth or the kids or the schools from a public health point of view. Their recommendation to us has been that you should choose to offer guidance that says if you have in your district the following scenarios with respect to positive tests, to operate on those guidelines, but not to make a decision that says everybody now should close.
Governor, how many tests
Seem to be
have been
making a blanket statement on gatherings of 250
Yeah.
people. So why is one okay and the other one not?
Well, keep in mind that when we talk about gatherings, right, we name the kinds of gatherings we're talking about. Large events, lots of people, many cases, seated right next to each other like this, standing in line to get in, crowded in line to get out,
Could be a wedding,
all the same.
right?
Yes, could be a wedding,
Yeah.
could be a lot of different things. But I think that's based on guidance we got from the CDC. I mean, that came from the CDC guidelines
No, I understand
and the
there's
CDC
guidance, but-
recommendations. They're not recommending all schools be closed.
Governor, how many tests have been done to this point?
I think we'll have an answer for that on Wednesday, right?
You don't know
As
now.
Secretary of
You can find it now.
Affairs.
Well, keep in mind that there's a constant ongoing process associated with testing. The reason we talked about whether to release something once a week or release something every day is that number, while it's in process during the course of the day, would not necessarily be an accurate number, and that we ought to tie it together to the same day that we issue the data around quarantining and do it once a week.
If there's a testing shortage, what should people do right now if they think that they have it? They say they're going to ERs, the doctors can't give it to them. What should people do if they think that they have this?
Let me answer Matt's first, his question. So, as of yesterday, in looking at, so yesterday's data was about 16 states post data in terms of how many tests have been run, and the other 16 don't. So this is yesterday's information. And in looking at those states, we have made a decision that we should, starting once a week, so every Wednesday, starting next Wednesday at noontime, we will have the capacity to post the number of tests that have actually been completed and the number of tests that have been negative. And as you know, every day we'll put up the presumptive positive tests. So to answer your question, can you just repeat it, please?
Yeah, people say they're going to ERs, they can't get the test, even though the doctors say, I'd love to give you one, but I don't have one. So what do you tell people who think that they have this right now? What should they do?
So when When a person feels that they have symptoms, as you know, we have said, first call your primary care doc. Go, and if you have a primary care doctor, see your primary care doctor. They walk through a series of scenarios with you. And if you need to be tested, they have conversations back and forth with our epi line. And if there's agreement, they were tested and it comes in.
But the
That is
doctors
that.
say that there aren't enough tests for those
So
people.
if you have a
so-
specific example,
Yeah, it's all over social media. People say they're going to ERs and there aren't tests, even though the Massachusetts Nurses Association is saying they don't have enough testing.
so we have testing right now for 5,000. We are testing 200 a day. Next week, we will have the capacity at our state lab alone to test another 400.
Are we asking
So how many people have tested negative? How many results have come back?
Right, as I said, we will start posting that next Wednesday.
Has anybody come back negative?
We will, the total number of individuals tested,
It
yes.
seems odd, I mean, you obviously have the number. Like,
Why aren't you
why
sharing?
why don't you just tell us what it is?
So we're actually putting that together right now so that we can start posting next Wednesday. All of the data in one place on Wednesday.
I understand that,
Do you
but
think-
why not
do
just
you
tell us what it is today and then start it on Wednesday going forward?
Like I said, we will start posting this next Wednesday and in time.
Do you think 400 tests a day will give us an accurate picture of how widespread this virus is in Massachusetts?
So what we need is additional labs to come in place. There is no question, in addition to our state lab, we need other capacity in our state to do testing, which is why the governor has been so public with the federal government to have more labs come in place, such as MGH and others who are really very close to being approved by the federal government.
Keep in mind on that one, that's part of the reason why it's so important that Quest and LabCorp, late relative to when we would have liked to have seen them get in the business, are now gonna be able to do it. That will make a big difference with respect to how many can actually get processed.
Governor, the FDA gave
Distance learning and working, will the state be able to handle that? Have you worked with any of the Wi-Fi people, the people who provide Wi-Fi? I mean, all these schools, all these workplaces are gonna rely on this starting next week, and how do we make sure that the system works?
Well, for the schools, I'm not sure I understand your question.
Can our technology handle everybody going online like this? To do distance learning, distance working?
Well, depending upon, remember, the internet's a very big place, okay? Most people who are engaged in any kind of distance anything are using somebody else's platform. So the question becomes capacity on the platform.
Have you reached out to
That's
those
a
platforms
different
to make sure they
different
can-
issue. With respect to state government, the first thing, and we've had many conversations with folks about this, is you have to figure out which sort of job criteria you could actually do on a distance, on a remote basis to begin with. I mean, many of the things we do would be enormously difficult to do that way. And I'll give you a really simple one from Health and Human Services. You know, we are still gonna need to do investigations on child protection issues. You can't do that working remotely. And there are all kinds of other things that state government does that are customer-facing operations that you can't do remotely. You talk to cities and towns, ambulance drivers can't do that job remotely. Police officers can't do that job remotely. Firefighters can't do that job remotely. I mean, there's a lot of work the government does that is much harder to put into a remote work environment than a lot of the stuff that goes on in the traditional private sector. That's fine. In places and spaces where we think it makes sense or that it's possible to pursue that kind of option, we'll certainly consider it. But a lot of the folks who do work in the public sector need to engage the public. It's the public asking us to do something, and that something typically involves, in many cases, us being in the place we need to be in when they need that support or that service.
Governor, the
you've been on a lot
FDA
of
today
Governor, you've
gave
been on a
New York,
call.
the FDA today gave New York the ability for private labs there to go ahead with testing without prior FDA approval, with the state health department there in New York overseeing it. Have you guys sought the same clearance?
We have asked for that. That's the first I've heard of that. Ours got approved at the federal level. That's a new policy.
Governor, is the federal
Really?
government putting
Yeah,
states?
that's a new policy.
Is the
Last
federal
one here.
government-
In fact, just a little history here. Washington started doing this without getting FDA approval, and they got shut down. So that's a very new decision from the federal government.
Is the federal government putting states in a tough position right now with its delayed response?
I think the issue, especially with respect to the back and forth, there are two steps associated with getting a lab approved. The first step is you need to get specimens from CDC that you can use to then prove that in fact your testing protocol is effective. You then take that and give it to the FDA, and then the FDA responds back to you and says, you are now approved to process labs. And this is the thing that State of Washington lab was doing without having FDA approval, and they got shut down. So what Matt's talking about, that's brand new federal policy.
Yeah, right.
So with respect to that, our issue all along has been move the process, because we have people like Mass General and Beth Israel and the Brigham, who obviously are institutions that have the capability to do this. We now have approval from the feds for Quest and for LabCorp to get into this space and up and operating. And you know, honestly, when we've talked to the hospitals who've got applications pending, and when we talk to the delegation, you know, the message that we've gotten from the hospitals has been, you know, we're this close. It's been this close for a while, and that's enormously frustrating, I think, for all of us.
Yeah, but in terms of the federal government, you've been on a lot of calls with the federal government right now, and as the leader of the state, you know, you have to take control of the situation, but if you don't feel like the federal government is moving quickly enough, I don't know, do you feel that way?
On this stuff, I've made pretty clear I don't think the feds are moving quickly enough, but the idea that I would put our entire testing regimen or our healthcare delivery system at risk by literally violating federal law, I'm not going there, if that's the question you're asking me.
How many
Thanks,
tests?
everyone. With respect to kids in
Just a
schools that are
second.
not.
He was asking.
Could you just explain, I don't quite understand this. You have people labs that are processing the test, and then you have the question of the test, which seem hard to get. Why are the tests so hard to get?
Well, keep in mind that that's another target that's been moving at the federal level. The federal standard with respect to what meets the qualifications to get the test has been changing, and they've been loosening the guidelines up over the course of the last few days. And I fully expect that that combined with some of the stuff around additional testing capacity will mean that there will be a lot more testing. But remember, you know, this is an important issue too. We have a very significant order in with respect to these kits that the Secretary spoke to. We currently have the capacity to do 5,000 tests, right? We have an order in 5,000 people, sorry. We have an order in to do far more than those 5,000, and one of the things we constantly are talking to the feds about is, are we gonna be able to get on a regular basis, as those test supplies are used, additional tests so we can do more. That's another issue where we rely on the feds to actually be able to deliver on this.
Governor,
many tests per day can
the
lab-
cancellation of the Boston Marathon, or the postponement on it until September, a sign of the times.
That's 1 million people, sometimes out there standing around cheering on runners for 5, 6, 7, 8 hours, shoulder to shoulder, 5, 6 deep in many cases in a lot of the locations. It's exactly the type of event where you could imagine, and by the way, because it happens in the middle of April, nobody's wearing gloves and hats and overcoats either. That's exactly the kind of event that I think is an important example of why you wouldn't want to have an event like that now, because of the contagious nature of COVID-19. I think the decision, which was, you know, involved a lot of parties here, the BAA, the hosts, the sponsors, the host communities, the sponsors, City of Boston, sort of everybody, to try to come up with an answer with respect to what to do on this. I think the decision to try and find an alternative date as opposed to not running it at all was the right way to go. They eventually came and talked to us and said, do you think you folks could designate a date in September, the 14th, as Marathon Day in Massachusetts? We talked to the House and the Senate about that. The House and the Senate both said that to not run the marathon at all would be an incredibly distressing decision, in part because it's a great event, in part because it's a big boon to the local economy, but also just because of the symbolism and the significance that that race represents here in Massachusetts and in the and in the city of Boston. And the legislature basically said, yeah, fine. So we'll file legislation on this. Marathon Monday will be September 15th instead of April 20th. Patriots Day won't be on April 14th, sorry. It won't be, it won't be Patriots Day, but it's gonna be a much better alternative than to not have it at all.
Are you
Thank you.
Are you convinced you have enough money to deal with this issue right now with the supplemental budget?
Well, the supplemental is certainly a great start, but everybody should remember that a lot of us have worked pretty hard over the last few years to dramatically expand the state's rainy day fund, where we now have $3.5 billion available. And I fully expect that over the course of the next, pick a number, 5 or 6 months, there are many issues we're going to need to figure out how to help people work their way through. But I would just say to everybody today that from our point of view, that's kind of part 3 on this thing. Part 1 is to get all the protocols and the operations in place around dealing with some of the issues that are associated with the arrival of the virus, right? Part 2 is to do what we need to do to try and flatten the growth in the number of cases. And I can't make this point enough, okay? We should remember that for the vast majority of people who get this, like 80% plus, we're talking about something that's gonna feel a lot like the flu, okay? That's what it's gonna feel like. For a small percentage of the population, and we've said this before, folks over the age of 60, Madam Secretary, you and me, but really people over the age of 70 and folks who have pre-existing conditions, this is a very dangerous thing. Part of what the objective is here is twofold. Is number 1, to try to limit the growth in the number of cases because it is very contagious, not because it's gonna, not because it's like mortality contagious to the vast majority of the people who might get it, but because if a whole bunch of people have it, the likelihood that a bunch of older folks or people who are dealing with pre-existing conditions might get it, and for them it's a problem, that's kind of goal number 2, right? The other piece associated with this is to try to make sure that instead of having it go like this and create an enormous peak, spike, whatever you want to call it, which would be a significant issue for the healthcare community just in terms of treating that 5% of the population for whom hospitalization would be required, you try to push off the rate of infection so you flatten out the curve and make it take place over a much longer period of time where you don't have a whole ton of people all at once who are coming down with the illness and are put in a position where those especially who are seniors or who are most at risk need hospitalization, and you have trouble coming up with the capacity to serve them. I mean, I think it is very contagious. I mean, just look what happened at Biogen. 175 people, 4 days, 70 cases so far, maybe more. No question that it's contagious. But for the vast majority of the people who get this, it's going to feel like they got the flu. The challenge is to limit the number of people who get it so that you don't put an undue burden on the healthcare system by having them all get it at once. And secondly, if you limit the number of people who get it overall, you limit the number of people who are in those high-risk categories from getting it in the first place, which has to be one of our major objectives. Because those are the people who, in many cases, if you're talking about people in their 70s, who dressed and bathed everybody in this room and a heck of a lot of people across the Commonwealth. They're the people who actually made your lunch and took you to school every day. They're the people who paid your bills and in many cases helped you get through some of the toughest parts of your life. And they're the people who in many ways we owe the most to at this point in time. And I think it's really important that we remember, because everybody says, oh, it's, seniors, they're the ones who have the most to worry about. Well, they're not just seniors, okay? They're the people in many cases are responsible for where we find ourselves. So if we can limit the number of people who actually get this infection and push the curve out, not only do we save our hospital capacity, but in many cases we can help limit the number of people who are at risk, which is a very small percentage of what could be a big number from getting sick in the first place. I mean, I think about this with regard to my dad, who's 91. I visit him almost every weekend. I'm probably going to be talking to him on the phone for a while. Because for a guy like that, it's a much different issue than it is for somebody like me.
Have you considered, it sounds extreme, but have you considered a shelter in place? Is that anything that was ever considered?
I think what we've been trying to do, and this is again based on the advice we've gotten from the folks at Public Health, is for people who are either tested positive or have close contact with somebody who has tested positive, the quarantine, the 14 days, the shelter in place, whatever it is you want to call it. I think an overarching shelter in place order, at least at this time, is just not appropriate given the facts on the ground and the data that we have. But we should be doing things to avoid ending up in situations where you have really large gatherings with a ton of people really close together, where there's a big opportunity for one person to infect a whole ton of people in a really short period of time.
Given the
Thank you. We gotta get going.
Two new labs that are going on.
Governor,
Pardon me?
How much capacity
Last
are you going
question
to get
here.
from 2 new labs that got FDA approval to do testing?
Well, I can tell you that, that the Quest lab in Westboro, they do a lot of tests, okay? But they do thousands of tests of one kind or another every day. And my guess is that on an incremental basis, they would dramatically expand our capacity.
Do you have
Thank you.
Thanks.
With respect to the students,
Yeah, that's the. Didn't say they would. Yes. Insurrection against the federal government.
Yeah. So,
Sarah,
so we.
do you guys have, or would you be able to get any what testing capacity we can jump to, have like 2 other labs on board? Would you get that, and how many other labs are connecting? He mentioned, I think the age of who else is actually waiting for the FDA. Okay, thanks.
What about the drive-through stuff? I want to go in I guess we can put it to. Yeah, I usually get these one half a sentence answers. It was a good long, 40 minutes.
Hey, Nick, this is Brian. We were up on the we are starting to cut off. Yeah. As of right now, this is already so. Yep, and I'll drop some of the Okay, great. Thanks, man.
Yeah, give me a minute.
Yeah.
Kids at home, you're gonna block it with you, the sun shining outside.
Hey, Kelsey, it's Brian.
Hey there, I'm standing here like.
Hey,
so very frustrating. We just don't get our list of questions in. You know, you're trying to get. I did ask him the power to shut down the school. It sounds like he does, but you know, he would need a real reason which he doesn't feel is there. I think the big news is no gas. I mean, no wedding. You're going to have 200-300 people.